Isaac, let me know when you're ready for slides and I'll be here to help you if you need anything.
Okay, thank you. Yeah, if you don't mind, you can go ahead and pull them up. Perfect, thank you so much. Well, thank you all for attending today. This is the Breakout Room 1, which is covering diabetes technology. My name is Isaac Smith. I'm a pharmacist by training and currently a clinical research scientist at Eli Lilly and Company. I am going to be talking today about connected insulin pens. Next slide, please. So disclaimer, I am an employee of Eli Lilly and Company. I did not accept any compensation for participation, and this presentation is sponsored by Lilly, and I am presenting on Lilly's behalf. So before diving into connected insulin pens, I really wanted to give the background of how managing an insulin regimen can be so challenging. And there's been several studies that have shown that it is complex and challenging to manage an insulin regimen, including the ones referenced here. In the first study, it was done in people with diabetes, or PWD for short, using insulin pens, and it showed that they actually on average missed 22.1 bolus insulin doses in a 30-day period. Another study showed that over 60% of people with diabetes say their treatment regimen is challenging and disruptive to everyday life. And in a third study, about 30% of people said that they may misrepresent or withhold information from providers due to fear of judgment. So those studies, along with a couple others shown here, I hope kind of demonstrates the complexity of diabetes treatment regimens and how that can cause emotional distress and negatively impact medication taking. Next slide, please. So one aspect of managing an insulin regimen that really contributes to the complexity of it is the paper logbook. It can be really burdensome for both people with diabetes and healthcare professionals. Even a meticulously maintained logbook can present large volumes of complex information, and that can become overwhelming and confusing to the person with diabetes, and it may even prevent them from acting on that information. It can also be challenging for healthcare professionals as well, when they have limited appointment times available to get pages and pages of this information, and to be able to accurately and make an informed decision on that data in a short amount of time can be challenging. Studies have also shown that logbooks are subject to reporting errors and information gaps. You can see this picture here. It's an example, it's a hypothetical patient, but you can see that information is recorded every day, but there's still a lot of gaps here. And with that gap, those gaps, it makes it challenging for healthcare professionals to make decisions, an informed decision on that care if they don't have the information available. There's also the possibility that a person with diabetes may forget to bring their logbook to the visit, which again makes it challenging for a healthcare professional to make an informed decision without that information. There was actually a 2021 study done that showed 47.6% of people with diabetes had no current method of recording insulin dosing at all. So hopefully this shows that there's clearly unmet needs when it comes to diabetes management in people on multi-dose insulin. Next slide, please. So one way that we may address these needs includes expanded technology. So diabetes technology has expanded to provide diabetes self-management support. And this includes the development of hybrid devices and software, and also the technology that I'm going to be speaking on today, which is smart caps and pens, which is in that middle graphic there. Next slide, please. So both the ADA, or the American Diabetes Association, or ACE, which is the American Association of Clinical Endocrinology, have defined what connected insulin pens are. And actually the ADA guidelines that came out this year in 2022 classified smart pens and smart caps into a new category called connected insulin pens. So they define them as insulin pens with the capacity to record and or transmit insulin dose data. ACE guidelines say that connected pens provide objective data regarding insulin administration and can be combined with self-monitoring of blood glucose or with continuous glucose monitoring for a better understanding of the patterns of insulin use. Next slide, please. So really, the next question is, what are smart pens and caps? So as you can see from this image, a smart cap is something that attaches onto a currently produced disposable insulin pen. And smart pens have that technology that's in the cap. It's already embedded into the pen itself. So there's no attachable, detachable component. It's the electronics are all in the pen itself. And they may be reusable as well. So smart caps and pens have features such as monitoring the timing of injections and also the quantity of the insulin administered that can really help assess medication taking. Next slide. Now, the important point about connected insulin pens is really in the title of it. It's the connection part or the interoperability of those pens. They typically work in conjunction with an app of some type that has an electronic logbook to record the insulin dose related information. Next slide. So here are some other features of connected insulin pens. So connected insulin pens and the applications that are associated with them may be programmed to record insulin type, dose, and timestamp during administration. They could set notification reminders to try to prevent missed doses of insulin. They may even assist with the calculation of insulin doses as well, or provide downloadable data reports for people with diabetes. There's also the potential for them to provide data reports and visualizations to healthcare professionals. And when referring to data reports and visualizations for healthcare professionals, the ACE guidelines actually say that the data regarding insulin administration that can be combined with glucose data can allow for better assessment of blood glucose patterns. So we talked about how there's an unmet need for people on multi-dose insulin and how connected devices can really help in that area. But the next question is, where do they fit in therapy? And one study showed that there is an opportunity to improve glycemic control. In one study, over 70% of adults with diabetes were not meeting their target A1C goals, which really shows us that there is
Isaac, I apologize. I lost internet. I'm back. Are you ready for the next slide?
Oh, yes, go ahead.
I'm so
That's
sorry.
okay.
Here we go.
Perfect. Thank you. So what has been shown in a study is that connected insulin pens can lead to improved medication taking and time in range. So smart pens and caps can support good injection behavior and fewer missed and more well-dosed mealtime injections and greater time glycemic range, which could subsequently lead to better glycemic control. In one study, connected insulin pen users with type 1 diabetes actually saw a 43% decrease in the average number of missed mealtime doses. And they saw that time spent in normal glycemic range increased significantly from 9.2 to 11.1 hours per day. There were also some reductions seen in hyperglycemia and level 2 hypoglycemia that were observed. Next slide. In addition, when surveyed, 97% of healthcare professionals actually saw electronic logbooks as a way to help optimize their time. So of those respondents, 100% actually felt like they could more quickly identify glycemic patterns, and they could help focus on problems with diabetes management. Almost 70% of respondents said that. Over 80% of respondents felt like they could make more informed decisions, and almost 80% felt like they could help optimize their time during consultations with PWDs as well. Next slide. And then I really wanted to give a hypothetical example here to kind of paint a picture of how a connected insulin pen and an electronic logbook may help a healthcare professional make a more informed decision. Because I know I've been talking about it, but it's hard to visualize how does that really affect decision making. So I showed here an ambulatory glucose profile. This is a hypothetical patient, but what you see in this top black box here, you see two boxes. The top one here is the glucose values. The two green lines, you want the glucose value to stay within those ranges. And the curvy black line is the glucose values throughout a 24-hour period for this hypothetical patient. What you see is that this glucose value goes above that top green line and the glucose value goes high when following that 6 a.m. mealtime you see there. So if that's all the information that a healthcare professional has, they may be tempted to say, I need to increase the dose of insulin that's given with breakfast to prevent that high level from occurring. But with a connected insulin pen and a logbook, you may see this they may be able to have this bottom black box of information here, which is their insulin doses. And you can see in that red column there, 9 units of insulin was given, but it was actually given at 7:30 in the morning, which is an hour and a half after that 6 a.m. breakfast. And it wasn't given until that glucose level actually reached its peak. So in this example, rather than make the decision to increase the insulin dose, which uses more insulin, has costs associated with it, and also has some risks associated with it for hypoglycemia, the education point here may be to actually just take that insulin earlier, closer to the meal, to prevent the hyperglycemia in the first place. Next slide. So in conclusion, managing insulin doses is challenging for people with diabetes taking multiple daily injections of insulin. Paper logbooks can be burdensome for both people with diabetes and healthcare professionals. Connected devices and connected insulin pens can really help with this unmet need. Connected insulin pens may lead to improved medication taking and time in range. And electronic logbooks may help with healthcare professionals optimizing their time and making more informed decisions. So now I'll turn to our moderator and see what questions do we have.
Okay, sorry about my technical difficulties. I do have a
No
few
problem.
questions for you, Isaac. The first question is, who do you think would benefit the most from connected insulin pens?
Yeah, so that's a big question. Who really benefits from these pens? And I would direct you to the ADA and ACE guidelines. They do a good job of mentioning who would benefit from those. So the ACE guidelines are a little more specific. They say that it's recommended for anyone with intensive insulin management, which they define as people taking 3 or more injections per day, and who may benefit from assessing insulin dosing to optimize their care. Whereas the ADA guidelines are a little more open-ended. So they actually say that connected pens could be helpful for diabetes management in general and may be used in patients using injectable therapy. So they just define it as anyone who's using injectable therapy may benefit from this.
Great, thank you. I've got another question here. What is the overall value of these devices in the treatment regimen?
Yeah. So really what we do know is there's been a few studies, which I can cite if needed, that show poor medication taking has been associated with smaller reductions in A1C and also poor glycemic control. And then in one of the studies cited on one of my slides here, an Adelson study from 2019, it showed that connected insulin pens have shown improved medication taking. So really, connected insulin pens may remove barriers to insulin administration and may improve visibility to healthcare professionals on dosing behaviors.
Great, thank you. And I think I have one more question for you. I don't see anything additional in the chat, so this will be our last one here.
Okay.
Why do healthcare providers feel like they can make more informed decisions and focus on key problems with these specific devices?
Yeah. So that the reason that occurs is because these devices are typically associated with an ambulatory glucose profile, which is what that example was, that image on that last slide that I was talking through. So it's typically associated with one of those that really combines all the data into visualizations that are able to be interpreted much more quickly than reading a handwritten logbook, which you can imagine would be challenging in a limited time space. And we talked about could be missing important information. So when used correctly, the information is available, it's presented in a clear way. It really allows the healthcare professional to make the best use of their time during an appointment, and it allows them to pick out key areas of interest from visualizations and help them make more informed decisions, which you saw from those survey results. Healthcare professionals felt pretty strongly about that.
Thank you, Isaac, and thank you everyone for joining. We're now going to go back to our main room.
Great, thank you so much, everyone.